45.
45 minutes.
Hello, Cam followers. It is lovely to see you. I have the amazing Dr. Mike Petty here tonight, and we will be talking about a topic that doesn't get talked about enough, and it affects every single clinician watching, every owner watching, is that link between pain and fear. None of us want our pets to either be in pain or suffering from fear. But before we go into this topic, I would first of all like to say a massive thank you to our big sponsor, and I'm hugely proud to be associated with them. This company's got excellent ethics. They put their money where their mouth is, and they actually prove whether they can have marketing claims such as AIDS mobility, AIDS sleep, AIDS pain. So this is Big Barker Beds, and thank you so much, Mr. Eric Shannon, for supporting us this year. We really wouldn't be here without them. Please go and check them out. And the next thing I would like to tell you about, I'm just going to take a couple of minutes because this is hugely important. The Big Walk. Do you know about the Big Walk? Do you know anything about the Big Walk? So the Big Walk is Cam's big sponsor event of the year. This is what keeps us going, guys. This is really hugely important to us. It started in 2017 when I did the amazing decision to go and walk 100 miles with my 14-year-old collie to raise money for Cam. And at that point, we only had 1,000 followers. So we raised £7,000, and it really did keep us going for a good 5-6 months. 2018, sadly, Holly wasn't well enough. 2019, we did walks in and around the UK and the globe and had 42 mini walks going on everywhere, raising money. And we raised around about £8,000-9,000. 2020 was a year that we all forget because that was COVID, but 2021 we came up with a new idea to make sure that everybody that follows Cam could get the benefit of this. It is a virtual online education event. You do not need to do any walking. So if you feel that you're not able to participate in a physical sense, you don't need to. So this is throughout the month of September. It's in association with the IVAPM's Pain Awareness Month. That is why we chose September. We want to work with our strategic alliance partner, the International Veterinary Association of Pain Management, which Dr. Mike Petty knows a lot about. And it's basically a massive education event for you guys to get involved with. It's lighthearted, it's fun, it's interactive. Please do go and look and sign up. We'll put some links in. There is also the little walks. So if you are physical and you want to do some fundraising events, there is also a pack available for you to do your own sponsored walks. Thank you to all our sponsors. We're really grateful to be given the opportunity to do this amazing event. Right, let's get down to it. Please tell us all about yourself so everybody has faith in what you say.
So my name's Mike Petty, as you can see on the screen, and I have been practicing veterinary medicine for just over 42 years. My interest in pain management came about before my veterinary career. I worked at this veterinary clinic that gave every surgery an opioid. They used local blocks. They did all sorts of stuff. Then I went off to veterinary school, and they did almost none of that stuff. And I've always known there was a better way. So it's been kind of an amazing time. I've been practicing during the time when we had almost nothing to control pain. And now it seems like every month there's something new out there. Maybe things we've had that we didn't realize work for pain, but new drugs, new modalities, things like our laser therapy, rehabilitation and so forth. So it really has been an amazing time to be alive and to be a part of this entire thing.
Well, a blast from the past. You were involved with Rimadyl and the Rimadyl adverts of the dog at the bottom of the stairs. Heartbreaking. And I remember when I came out of uni 20 years ago, there was probably 2 non-steroidals to choose from. There was meloxicam and carprofen, and that was what we had.
Right.
But you would have preceded me, and even they would have been short supply. The whole concept of using anti-inflammatories and stuff.
Right. Pfizer Animal Health came out with Rimadyl in, I believe it was October of 1996.
That's when I started uni.
Yeah. Up to that point, we used phenylbutazone and crossed our fingers. We used aspirin and crossed our fingers.
Yeah.
And that was it. we had nothing else for chronic pain.
Yeah. And I think people don't remember, they don't realize that it is the changes that we've seen in these last 26 years are incredible. Incredible.
Yes.
And it does frustrate me when people, they give the pharmaceutical industry, for example, a hard time. And I sit there going, do you not know the jumps that we've made? It's pretty phenomenal what we now offer, as you say, compared to what we did. So,
and not only the jumps that have been made by the pharmaceutical industry, all the millions and millions of pounds and dollars that have been put into products that never saw the light of day because, they felt like they weren't safe enough, they weren't effective enough, whatever reason. So, I know that it seems like pharmaceutical company bashing is like really popular these days, but if you have worked with one like me, you've seen the inner workings, and there's just they really care. At least the ones I've worked with, the veterinary ones, and it's there's the bottom line is always part of it because you have to make a profit to make product and make more product. But it's the caring and the concerns that really drive them.
yeah, no, I agree. I was very lucky to recently go to Boehringer in Frankfurt, an unbelievable establishment with extremely strong working principles,
Right.
and really wanting to push out product excellence. And yeah, I'm the same as you. I'm very much holistic in my mindset of we need to use all different angles of attack to get the best for our dogs. But to poo-poo something that has worked so hard in leaps and bounds seems very sadness to me.
Right.
Okay, so getting into the topic. Because it's kind of like, where do we start with this topic? I decided to start with a bit of a quote to get people thinking, oh yeah, pain, emotion, cognitive, behavior. So I'm going to read this and I'm just going to let it flow. I have got an agenda, guys, but we're just going to see how we move from this, okay? So here we go. Pain is actually defined as an unpleasant, subjective experience with a sensory and an emotional component. Psychological health comorbidities, especially anxiety, depression, and anger, are highly prevalent in people with chronic pain. People with depression, for example, have about 3 times the risk of those without it of developing chronic pain, and those with chronic pain have about the same increase in risk for winding up with clinical depression. Multiple studies of osteoarthritis, rheumatoid arthritis, lupus, fibromyalgia show that people who experience more negative emotions also report more pain. Ooh, there's so much to unwrap there, isn't there? And I think people think, oh, yes, a painful experience is going to create fear, but fear can make pain worse. Please expand upon this for us.
Right. So I think you can boil that statement down to pain is not only how it feels, but how it makes you feel. And it is a self-feeding loop. The pain center and the emotional center in the brain are all around the hippocampus, the amygdala. And I mean, they're like this close to each other. That's why if you slam your finger in a cupboard door or bark your shin or something like that, a 4-letter word wants to come flying out of your mouth because they are that closely connected. And I like to say, one of my favorite sayings is pain and fear are really 2 different sides of the same coin. It's heads and tails, as we say in the state, but one side is pain, one side is fear, and you can't have that coin without both of them.
Yeah, no, definitely. I think what I'm going to do is I'm going to quickly jump to the Sam Lindley quote. I've actually just been doing a 4-day acupuncture course with Sam Lindley, and high five, Sam. It was really, really good 4 days. So because I want to just play on that again. So Sam Lindley talks about acute pain, also known as adaptive pain, which is there to prevent us from harm, protect us from doing harm again, and to protect us so that we can heal. And she links that very closely with fear. So adaptive nociceptive pain and behavioral changes are in many ways logical. Harm and damage creates fear of further damage, so you protect yourself. Maladaptive pain is less logical, but there is therefore a very big link to the acute and fear, chronic and anxiety. chronic anticipation of threatening of a negative stimulus hitting you again. So yeah, I just, it's so logical when you kind of read it, and I think people don't bring it into practice enough, that these two things, or these negative emotional states and these experiences, are so highly interlinked.
Right. On the animal side, there was a study done, and I'm afraid I don't have the name and all the authors in front of me. I know that a colleague of mine who's a behaviorist, Margaret Gruen, out of North Carolina State University, was one of the co-authors. But they showed that there was a connection that between fear and pain, and in 80% of the cases, fear was helping drive some of the. I'm sorry, I'm getting around. Pain was driving some of the behavioral issues. You know, and these are anywhere from, you know, inappropriate urination to aggression to whatever. If they could remove the pain, the behavior issues went away. So it's really astounding. You know, there's a person over in the UK. She's from Scotland, and Scotland's still part of the UK, right? Just kidding.
Yeah,
Um, so her name's Jo Cameron. I don't know if you've ever heard of her.
yes.
But yes, she was born with the inability to feel pain. She's she's knocked her teeth out, broken arms, had babies, everything else, and has never hurt. And the most astounding thing is she has no idea what fear and apprehension is. Nothing bothers her. So, you know, is this something that we learn at the moment of birth when we first start to, you know, feel our first pain? And, you know, this is how we start to become fearful and have behavioral issues. Who knows?
No, absolutely. As you say, the pain, that protective mechanism of pain creates fear to prevent us doing painful, dangerous things to ourselves again. But if we stay painful, that fear persists, and that's when it becomes anxiety, and anxiety leaves you in a state of inability, lack of capability, lack of coping. And yeah, absolutely. And I think the reason that we at CAM really wanted to talk about this is because I think there's still a tendency for people to see animals experiencing pain in a very 2D way. They're in pain, switch off the pain, everything's okay. There's no preempting and changes in behavior before a potential painful experience, so that we don't make allowances that this could be scary. And then we don't have any allowances for, well, what did they experience and how are they going to feel about it again? And could we make that better? And can we also make it better so if they are consistently in pain, chronic pain, how does that negatively affect them and make their pain worse, and what can we do about it? And I do feel that people see pain management in animals still very simplistically. They're in pain, take it away, it's done.
Right, right. And you know, that kind of reminded me of another thing, talking about people from Scotland. There's some kind of a genetic variation, and I believe it is red-headed females that have a tendency to have an increased sensitivity to pain, and things hurt more. So one of the things I always tell people is pain is what you say it is, and pain is what the animal says it is.
Yes.
That if you know, the thing I hate is like, oh, my dog's being a drama queen, she's such a princess, whatever. We don't know. We're not in that dog's head, and it has either had painful experiences, and the anticipation or the fear of it is going to hurt, or maybe actually it does hurt more than it does for another dog. And you've probably seen this in your practice. You know, like for example, what we call the northern breeds, Huskies and Malamutes. If we do a pain study, they're not even allowed to be in it because they scream and yell at everything. And you know, yeah, right. And you know, and there are a few other breeds that seem to be like that as well. Shetland sheepdogs seem very sensitive to pain and so forth. I truly believe there's a genetic variation, and that's why maybe we get some of the behavioral issues with a few of these breeds.
Yeah, no, definitely. So taking it into like a real world experience, we're going away from academia. We've allowed people to go, oh yeah, that makes really obvious sense. Okay, so we've got over the obvious. Now we're going to talk about pain and fear and how associated they are, but in identifying pain, then we're going to talk about it in the context of best management in kind of the acute situation of coming into practice, how we can make that experience better. So therefore, hopefully less pain is experienced. So therefore, less further fear is created. So therefore, less hesitation about being treated by vets, vet techs, etc. And then we're going to talk about it, hopefully, in more of the chronic pain setting, best management at home. So try and choose those three. So let's start about identifying pain and using fear to help us go, there's something wrong.
So I'm going to work this backwards. I had one client that came to me and said, ever since you treated my dog, and I've had cat owners say the same thing, it is no longer attacking the other animals in my house. So I think, so that really led me. It was my first aha moment that fear really can lead down that road toward unwanted behaviors. And, it's not always, first cats almost never limp unless their leg is snapped in half. They just lose that graceful tiger-like fluidity of movement as they walk around. And maybe I'm rambling a little bit here, but when you see unwanted behavior, what I'm saying is you're not going to necessarily see your dog limp, your cat limp, whatever. You're going to see reluctance to do certain things. So, that fear of they look at the step and they don't want to do it, but they end up doing it. That fear of, jumping down from a vehicle, whatever it might be. Those things are just paramount for saying there's something else deeper here. What drives me crazy is we hear this excuse all the time, and I hear it from veterinarians as well, that the dog is just old, the dog is just lazy, the dog is just whatever. We've bred dogs to be puppies until their dying days, and they love to do stuff, and any change from that behavior is often related to fear of pain.
No, absolutely. I'm going to do a confessional so people can either love or hate me, because it's best to say how things happened and how you've learned. Holly, the love of my life, the dog that preceded Luna, massive learning curve in that she had a noise phobia. And I'd moved around. I married somebody in the Air Force, so I moved around a lot. And it got to its worst when we were in Germany. We'd moved to an Air Force base. So you're always coming up with reasons why this noise phobia has developed, and always an explanation. And at that point, there was no literature to suggest that noise phobias, fear, and pain were connected. So I didn't even think that there'd be a problem. And looking at her physically, she was still doing everything every other dog. She was 6 years old and she was still running around, having a great time. We were paddleboarding, we were doing everything. I had no reason to suspect pain. And looking back, shortly after that, within a few years, she started an very occasional limp and falling once a month. Short, very short duration. Probably only 2 or 3 steps when you're out. And you kind of let that go. You kind of go, did I see something? Did I not see something? What's going on there? Long story short, it wasn't until she was much older did we take x-rays for another reason, and slip disc in her neck. She had cervical disc disease, and it was quite well established. And I wonder, was that neuropathic pain? And had she heard something maybe when I was in the Air Force Base, a jet taking off, startled herself because of the noise, created pain, and then the connection, and that just manifested, and it grew and it grew, and it got really bad. It got really bad.
Right.
And I look back and go, oh my God, if only I knew what I know now, I could have done so much more.
Right.
And I think for me, I kind of get tearful thinking of what she lived with. Like, we don't know how bad her pain was. It might have been just as and then, but it could have been consistent background, occasional worsening. But her love of being with me, their commitment to us, their loyalty, she still got on with life. she still was always at my side. She would still get in and out of the car, up and down the steps, jumping on off the bed, because me as the resource was more important than the pain.
Right.
And when you try and say that to an owner, your dog has only stopped jumping on the bed because the resource is no longer able to outweigh the painful experience.
Right.
They find that quite hard to understand. But dogs will go through pain to continue their companionship with us, won't they?
Right. They really will. And that's a really good point that you brought up. And first of all, I'm always saying to myself, if only I had known then what I know now, I could have helped that dog. And there are certain dogs and cats that it really haunts me from my career, that I think if I had just known, I could have helped. But I didn't, because it's an evolving process. So don't take yourself too hard. But I tell people that, and especially veterinarians, I tell them, remember, arthritis, especially in dogs, is a young dog disease. Dogs have arthritis. They often develop it by the time they're 1 or 2 years of age, but they don't know any different. So they soldier on every day like nothing's wrong. And the reason for that is in people, we usually get arthritis from repetitive motion, from doing something stupid and hurting ourselves, from rheumatoid arthritis, things like that. Dogs, 90% of the cases are really due to things like hip dysplasia, elbow dysplasia, chondrodystrophic breeds where they have the short limbs, things along that line. And that is set in motion by the time they are a year of age. And, because, and you're right, it's as I like to say, we have a tendency to ignore it as an owner because it's not causing us an issue, and it's not causing the veterinarian an issue because the owner's not bringing it up, but it's been an issue for the dog all along. And then when they reach that point where they can't get on the bed, they can't use the stairs, that is when we all finally pay attention. And veterinarians are just as guilty of that. We're busy. We sometimes have 15 or 20 minutes for an appointment, and it's backed up in the waiting room. And sometimes something kind of tickles the back of your brain that there might be something going on, but it's always hard to pursue, especially if you have a client that, suddenly looks at you like, really? And
Yeah.
so
how many times has that happened to you as well? Like, I'm still in first opinion practice. So people aren't coming to me with pain anywhere on their agenda. And they might come in for a vaccination, and I'm like, so when your dog's just walked in and what you've just told me in the history, I've got a real suspicion there's an underlying pain component here. And you can see them just go, I came in for a vaccine, love. Sorry, I wasn't expecting this. You're like, oh, this is so complicated.
Right. Well, I think partly people are worried, oh, what's this going to cost? And two, they don't want to hear it. They don't want to hear that anything's wrong, that, because you hear something like arthritis, everyone knows in the back of their mind it's forever. Their father, their grandfather, or whoever had arthritis, maybe themselves, they know it's only going to progress. So sometimes you just have to plant the seed, and they'll come back.
Yeah.
I think a really good resource for this is to really utilize the entire veterinary team as you're doing it. And my receptionist is just amazing. And so, so she'll get a phone call, and it's like, I need to bring my dog in for this vaccination appointment. And she'll say, okay, how about at 10 a.m. on Monday? Oh, no. The dog can't get in the car by itself. I need my husband to be home at 3 to get the dog in. It has to be after 3. And, so it's like a team approach. The receptionist has to hear that, because, the dogs, they come in, even if they're arthritic, they're pretty pumped up when they come into the exam room. And they're like, nothing's wrong. I want to go home. Let's just get out of here. Give me the shot. Let's go. But if, there's a note on there, dog can't climb in the car anymore,
Definitely.
Right. And that's a clue for, maybe your assistant or nurse to, give a really easy pain brochure or something like that. And then by the time you get to it, say, it sounds like there might be some pain issues, and then have that discussion.
Yeah, definitely.
Rather than throwing it in their face.
Yeah.
So, for the dog owning clients that hear this, we're really there to be the advocate for your dog. We want to say what the dog can't say. Your dog talks, it just doesn't speak English, and we listen to it by the way it acts, and by the way it looks, and by what we feel. So
Yeah.
we have to be
And
that interpreter.
I think both sides of the table, we both can do better. I think when you look at that, vets, we've got to have the confidence to say what we see and not back away from it. We need to stay current. We need to listen to these new pieces of evidence, linking behavioural changes, for example, with pain. We need to stay current with our interventions. We need to push for a diagnosis to get the best interventions. We've got a lot of work to do, use the whole team, etc. But owners, you've got work to do too. You've got to have the confidence to ask for advice. You need to say, is this normal? Well, we were just talking about things that we've missed. It's so daft, cute, but a kick every time I think about it. When people go, what's something that, a case that you can remember missing? And it's so simple. Somebody once said to me, he doesn't use his tail anymore. Is that okay? And I was only 2 or 3 years graduate. I went, yeah, I'm sure that's okay. It wasn't even something I thought of, No one ever taught you at uni. So when they don't use their tail anymore, this means underlying pain. But I look back now and go, oh wow, that could have been something. That's going to be some kind of disuse atrophy. This is going to be some kind of lumbosacral stenosis. There was something there I didn't see because I didn't know.
Right.
So yeah, whenever you think of me now, you can think of drop tail.
Well, I'll tell you my embarrassing story. I had a woman come in with a cat, and my cat's just not walking. It just doesn't want to walk. It's acting very painful. And it was again, a few years out. And it was sometimes hard to look at an animal and see the whole picture. But I did as good of a pain exam. I flexed all the joints. I looked at everything. I said, I can't tell what's wrong with your cat. And, I'm not really sure what to tell you to do. At the time, I think I gave it some corticosteroids for a couple of days because that was the other pain medicine that we had. And I asked her to recheck, and like in 2 weeks, and she missed her appointment. And I called her, and she said, well, you dummy, you never looked at the bottom of its feet. It had this skin rash on the bottom of its feet. I had to take it somewhere else. And, so
yeah.
Yeah. So there's always a reason.
Yeah. I know. Just so that followers have more empathy for veterinarians.
Yeah.
We go home and we ferment this for weeks. It's like when something goes beyond, under my nose, I haven't put 2 and 2 together. It could have been on the differential list. My worst enemy is myself, because I will absolutely haunt myself rotten. Oh, you should have known better. So just remember that, guys. And we've got questions coming in. I'm not ignoring you. I'm just going to bring them in when appropriate. So next, I think now that we've dealt with the fact that fear certainly can indicate pain, and we should be receptive to our owners' stories about changes in behaviors and routines and habits, and prick your ears up. And remember the CAM, chronic pain factor. I don't know if you've seen this. We've got a diagram in the center. It says chronic pain, and at the top it says behavioral changes. There's 3 lines where people can, possible behavioral changes, postural changes, physical changes, capability and gait changes. And people can go, I need to check that out. So that diagram was there because a groomer came up to me at a conference and went, I'm pulling my hair out. I keep seeing animals that I believe are in pain because of what the owners told me, what I'm seeing happening with them physically. I send them to the vets and they don't see what I see. Help me. So you're like, all right, I'm going to make you this. And it's a A4 PDF. You can print it off. You can use it as a dog walker, as a groomer, as a pet shop owner, as a veterinarian, as an owner. Use it to communicate, because that's what we need to do. Okay, now we're going to talk about, in the context of trying to make a fearful, painful experience, such as a vet visit, better. Why is it important? What can we potentially do? And then after that, we'll talk about fear making pain worse in a chronic context, what we can do. So what do you do? Because you've got a beautiful practice. What kind of things have you got going down in your practice setting before arrival and as they leave, that sort of thing?
Yeah. So, we are everyone here is certified and fear-free, and we have a cat-friendly practice. And so we try to teach our clients how to reduce the fear coming in. We use pheromone therapy within the clinic to reduce it. We have a specific cat room. We try not to schedule appointments so that cats and dogs are in the same waiting area at the same time. It just doesn't go well. So we schedule cat appointments for a while and then dog appointments, and just things that are triggers. And it's also, if a dog comes in and it's both painful and fearful, we try to find out, we talk to the owner, are there triggers that seem to make this worse? The other thing I learned early on is, in the UK, do you have a drug trazodone? Yeah. So it was kind of by accident that I put two and two together, but I got certified in acupuncture a long time ago. And when these dogs initially came in, it was hard to get a needle into some of them. I mean, it was just, and I think it was twofold. One, the fear, you're going to touch me, you're going to hurt me. So reducing the anxiety with this anti-anxiety drug trazodone helped. But I think also it let the dogs wrap their head around what was happening, so that it became less fearful and hence less painful. Yeah. And I rarely had to do it for more than 2 or 3 visits. Yeah. And then I would say, let's skip it. Same dog, same pain issue, but suddenly they were handleable. So absolute connection between fear and pain with those dogs.
Absolutely, and that's a really good point. A key take-home message for any follower listening: if your dog is going to the vets is hugely stressful, vet practices now have the capability to really help you with that aspect. You just need to ask. So you need to say, my dog's level of anxiety and fear and coming to the vets is getting way, way worse, and I am dreading it. He's dreading it. It's going to escalate to the point that we're going to struggle to come in for an emergency. What can we have in place? And it might be that trazodone, gabapentin, Cilio, there is a number of products out there now. You just need to be prepped. It's a bit like a child with car sickness. Chuck them a pill, get them ready to go. It's the same kind of concept, that you're prepping for that experience, and you will thank me in the long run, because these things do tend to get worse over time, don't they?
And if you prevent it, they get better over time. Yeah, they really do. Yeah, I used to say, before I really had that connection, I used to say to clients, fear is pain. It's a painful experience to go through, to be afraid, not realizing that it actually led to other types of pain. But, why the statement of what kills you doesn't kill you makes you stronger is absolutely wrong. What doesn't kill you is just going to grind you down and make the pain way, way worse.
Yeah, it's totally true, isn't it?
Right.
But I was just going to add to that oh God, it's gone in and it's gone out the other ear. That's age. I'm 44 now.
Yeah, it is.
But trying to minimize fear is a really important thing. Also, for the fact that we want to be able to examine the dog. So them arriving in a less anxious state means that we're going to get more out of the examination. We're going to get more information as they do a gait analysis, as they do a transition in the waiting room, all of this sort of stuff. We're collecting information. What about in the context of doing like diagnostic workups and stuff like that? I'm beginning to say to people, bring their own bedding. If the smells and stuff like that can be really helpful.
Favorite towel, favorite toy, whatever it might be. Yep.
Exactly. And if that means that they come in just before the procedure and we let them go as soon as we can do, or try and minimize how long they're in the practice, if we know that is going to be hugely difficult for them, we try and do procedures maybe out in the car or outside, so that we can keep that stressful state low. We've got yoga mats cut in half, rolled up in the clinic room now, so that people don't have that slippery floor, huge anxiety that they're already wanting to run away, and then they're trying to do a Scooby-Doo across the floor as well. So we've got things like that.
Right.
All that. Oh, and I tell you what, we've just got, you're going to be well, Jeff, but you've probably got one already. We're making a sensory garden out in the practice. We've got an area in the car park
Oh,
that
that's
has
nice.
been abandoned. And we have got plants in tires, we've got different surfaces, we've got wind chimes, we've got mirrors, we've got this area where we can just let them go, and the owner and them can chillax prior to being seen. So yeah, there's loads of things that you can do. So anybody in the practice, think about what you guys can do. Owners, possibly drop a hint to your practice. Have you thought about doing this? And don't be scared to ask, because minimizing fear in that situation is really important, because it will have an impact on pain, but it will have a massive impact on what we get out of that situation and future situations. Now let's take management of fear into the chronic pain context, in the long-term management, home management, etc. Why is this important?
It's important because it's, clients really have to understand that their dog or cat is never going to get better. Doesn't mean that you cannot, from time to time, ease back on medications and therapies and so forth. And that's really a huge discussion, especially with things like NSAIDs and the newer drugs like Silencia and Librela. Do we have to give it every month for the rest of their life? And the answer is probably not. Once you've soaked up some of these things and you've reduced the inflammation, then the pain isn't so bad. But the problem is the original problem. Paying attention and realizing that stuff is creeping back up. So, as long as I have an astute owner, I'm okay with saying, it's okay to maybe ease back and only give it on the weekends when your dog's running around and so forth. But if, I feel like this was a hard sell in the first place, daily is, constant treatment is the better way to go.
Yeah, absolutely. And we'll talk, there's a question about pain trials in a minute. We'll come back to that. No, I totally agree. I'm definitely finding that I see almost a little bit of a relaxation in my owners when I say, this management plan might not be for life. It's going to fluctuate. If we get on top of the weight, we control the lifestyle, we put these positive changes in place, we can potentially come back from our pharmaceutical interventions, the scope. But there's such a belief that once you go on to pain relief, that's it for life. And
Right.
I think people are quite in fear of that themselves, financially, physically, emotionally. It's a big concept. My dog's going to be on meds for life. And I just wish people realize that it fluctuates, as does the disease.
And sometimes it's, there's a physical price to pay too. You see someone who, only weighs 90 pounds and they have a cane corso that weighs 130 and this dog's arthritic. You have to have that kind of conversation with them. What's the price of this? And sometimes, unfortunately, the end price is, I will not be able to take care of my dog to the extent that it needs. And, perhaps euthanasia might be a better course. It happens rarely, but we do see it with really elderly people that have a large dog and they themselves can barely move around.
I agree.
Yeah. And it's sad.
It is sad. It is sad. But before people get there, so don't, it does happen, but there are so many interventions out there now.
And many non-pharmaceutical interventions. And, being 65 years old, the millennials and Gen Xers are like really driving me nuts with their generation. But I've really come to appreciate them because they're really demanding a lot of non-pharmaceutical interventions. They want to try other stuff first. It's not that they're against them. They want to try the non-pharmaceutical stuff first. And it is very possible to manage a lot of these animals with proper weight, the right type of exercise, coming in for massage or acupuncture or laser therapy, any of those things.
Yeah,
so
definitely.
There's always something. There's always something different you can do.
Yeah. And I'm doing chronic pain clinics now at the place where I'm in Cornwall. If there's any vets out there that are looking for a change in career, we are recruiting. So please do get in touch. I need a new vet nurse and a new vet because we're getting busy. Because what I'm finding, the more we add to our extensive toolbox, the more time it's taking, and we need to recruit. Because as you say, even just in a small opinion practice that we've now got laser, acupuncture, massage, therapeutic exercise, obviously we've got weight control, we've got our pharmaceutical interventions, we've got our intra-articulars, and we don't have a CT scanner. We haven't got any referral specialists. We're just a small opinion practice saying this is really important to us. So it's exciting, it's just so good. But going back to managing fear in the home environment in the context of chronic pain, musculoskeletal chronic pain management, I think people need to hear that fear will make pain worse as well. I know that we've got them as brother and sister, they're little siblings, together, but they can exacerbate each other, can't they?
Right.
So
And so one of the things that I'll see is sometimes these dogs and cats that are painful, it starts to increase social isolation, and they don't hang out with us anymore. Well, take a look. Do you have hardwood floors that are slippery? Get the yoga mats like you use in your clinic, and suddenly they're walking around. They have like those hospital socks for dogs that they can put on that have the sticky bottoms. I mean, there's all sorts of stuff that you can use. But yes, so the social isolation because they're afraid to come in the room you're at, but then they sit there and think about their pain all day. Dogs live in the moment, and that's both a good and a bad thing. They don't fear death so much. They don't fear the future. But on the other flip side, they think that whatever they're experiencing this moment is their life forever. And if you can't change that, that's like really sad.
Yeah. That's exactly what I was going to say when I suddenly went, oh my God, my brain. I'm 44. I can't remember anything more. Who was the person that told me? Ian Self said it. Do you know Dr. Ian Self?
No.
He is a beautiful man. You would love him. He is very much like you, really dedicated to pain management. I think he's at Cambridge now. So he said in a conference I went to, and my heart.
Wait. Is he a surgeon?
Don't believe he's an anaesthetist.
Okay, no. Okay, never mind.
Yeah. And a lot of these people that are very focused on pain have had pain themselves. I know that he's had a very painful condition throughout his life, as his Gwen Covey Crump. So very driven to get more information out there. And when he said it in this conference, I when you just, your heart feels heavy. The idea that an animal in pain or in fear doesn't know it will end. And in many ways, not having that ability to have foresight and go, okay, I've got toothache, but when it gets sorted, I can live with this until it gets sorted. Having an animal going, this is it, I don't know when it ends, is actually quite distressing for me.
It's distressing,
Yeah. Okay, so but knowing that fear can make pain worse, I really hope that people will look at the interventions that they can do at home differently. So there's a little simple formula people seem to have, which is pain plus drug equals kind of zero. Is, let's just do this, blah, 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 done. And looking at things, as you say, putting rugs down, making sure they've got a good bed, making sure that your behavior patterns, the way that you approach them, you suddenly pick them up, you don't shout at them when they hesitate, if they seem a bit fearful of next door neighbor's dog, give them space. These things indirectly are pain relief. And I know that's really stretching it, but you would agree with me because I know you're on my side.
Yep.
And people sit there going, she's lost her freaking marbles. So how do you feel about that when you can say, actually, those things that you think are just like sugar on the top? Right. If you could actually bottle it up as a pill, you'd be like, I could market that.
Right. Well, they do this all the time in human medicine, learn distraction techniques and so forth. And, we can't do the exact same thing with animals, but we can distract them for themselves, and that gets their mind off of it.
Yeah, definitely. And we this is a confession. So about 3 years ago, I had this amazing idea. I was going to make a pain relieving dog toy, and I had it designed. We even got to the CAD stage where we were going to have it actually 3D molded, and I was going to create some kind of clinical trial. It's going to be a prospective control study using validated tools. I wanted to prove you could make a pain relieving dog toy. And then I realized that every dog toy would actually fulfill the same thing. So, if a dog actually has something that they like and they enjoy and it gives them pleasure, it's a pain relieving dog toy.
Right. Fair?
Good. I'm glad we speak the same language. It makes me very happy. What other things could we do talking about pain to relieve fear? So just as we're coming to an end, we've talked a lot about multimodal approaches, and I think for the people that have endured me being all bubbly and happy that I'm talking to someone with the same language, could you just quickly give people that are new to chronic pain management a few recipes? Like, think of some cases of, well, with that one we did this, 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 and this, and on that one we did this, this, and this, because I think a lot of people still do believe that one disease requires one entity of treatment.
Right.
So tell me about 2 or 3 cases, only a minute on each, of what interventions you've come to that have got you to a good place so people can understand this multimodal.
Right. So I think one of the really great things you can do is learn some basic canine massage techniques, or cat and dog massage techniques. Dogs take to it a little bit better, but I was just looking at my in my library looking for the book. There's a book out called Canine Medical Massage by Narda Robinson.
Oh yeah.
And it could be something you buy for one of your nurses, and they could learn how to do it. You could recommend it to a client, and they could do it at home. And I have seen a lot of, especially my chronic cancer patients, where they want to keep them comfortable. Massage is like freaking amazing. It really does a good thing.
That's what I can. I just suddenly had my eyes open. I was like, oh.
Yeah. Another intervention. So I think, the big thing that I do for clients at home, and I've done it for my clinic here, is you have the yoga mats in the clinic, but if you own a clinic, you can actually buy rubber flooring made out of recycled tires. Your clinic smells like a tire shop for about 2 weeks, but we have this slate flooring out front that's not that slippery, but when dogs come in that are arthritic, they're walking on the slate kind of like this, and then they spot the rubber flooring, and they start going really fast so they can get to it, and you can almost feel them go when they get there. Totally. So you can do that at home. You can buy yoga mats and in like 10-meter rolls, and cut them to size and shape to get around your house. So that is something that everyone can do. The other thing is, I think that, and this is really for dog owners, you can get harnesses, and I don't know the brands that might cross over, but here we have one called a Help 'em Up harness.
We have it.
Okay, yes. Great. And that can inspire and help your dog, because suddenly it doesn't mind going down the 2 or 3 steps to go outside and to go out and get that sensory input. There's another brand here called Ginger Leads, and it looks more like a log carrier. You just put it under their chest and you use it to get them right. Those things make a world of difference in dogs' lives and save your back.
Yeah, definitely. We've got them in the CAM online shop, just so people know. You'll never find a supplement and things in the shop, because that's for the vets. That's the vet area. What we are very much about lifestyle and enrichment and education. So do not be disappointed. It's not that we forgot. It is very much about, we're trying to be filling in the gaps and helping you with the home management plan. So we've got them if you're looking for them. Last couple of minutes, let's just throw through some of these questions, because I think it'd be really good to have your input. We'll whiz up to the top for the people that were waiting. Where is it? And there was this, but there's so many papers about pain. I'd like to say, go onto the CAM website or do one of the CAM courses for owners or for professionals. if you're a canine professional doing the CAM advocate course, I spent a lot of time talking about pain and the pathophysiology of it, so you'll have a greater understanding. But if you're struggling, contact info@caninearthritis.co.uk and we'll help you there. Blah, 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 blah. This made me really happy. My aggressive, reactive, fearful Rottweiler is a completely different dog since having his slip discs dealt with. What has been said makes so much sense. Thank you, Annie. That makes me very happy. This person would like to know about Boswellia. Is it part of your toolbox?
So, that's something that people can buy over the counter. And Boswellia has been used in Indian medicine for like 1,000 years, and it has properties similar to NSAIDs. And it is one of the few supplements that I actually kind of believe in. Is it enough? No. But is it part of the multimodal therapy? Yes. I think it is not a bad idea to use it.
Do you know what? You just made me so happy because I almost would say verbatim what you just said. This is great. Oh my God, I'm so going to have a glass of wine after this and feel very content. Because sometimes you find people are very, very focused on using anything but pharmaceuticals. And I just think sitting on that fence going, look, we've got all of this to try, and I'm going to go for things that got strong evidence, and I'm going to utilize them. And if I use this as well, if it works, then I can come off of them. But let's see. Let's not.
Right.
It's not war. They're not fighting each other. Love it.
Right.
Thank you, Sharon, for mentioning CAM in your presentation to the vet clinic. I'm sorry that it reminded you of sad things, but I think anybody that goes into the pain sector go through this. We all suffer what we've missed. I have this one. I have 11-year-old ex-racing greyhound on gabapentin, Proficox, and Librela. Any other suggestions? She's still displaying some evidence. So this is a little bit difficult, Fiona, because we are not your vet, and legally we are not allowed to offer commentary, especially pharmaceutical commentary, on cases that are not in our care and we haven't physically examined. Again, please go to the CAM website. There is so much in there. We also have a course called CAM Essentials. There is a whole section. There's about 3 modules just on pain interventions, looking at integrative, looking at pharmaceutical, looking at supplements, looking at lifestyle. So much in there. Please go to the cameducation.co.uk and Lynn will put the link for me. We've got one down here. Now, Glycoflex, I believe is glucosamine. I believe.
Yeah, I think it is glucosamine, chondroitin, and sulfate. The studies on those have been disappointing, but I do have clients swear by them. I know in the U.S. they did a study, like a 10-year study with nurses, human nurses with chronic OA pain of the knee, and there was no difference between placebo and, So I just don't know what to say. If you want to try it, go ahead. I think maybe there's better things like Boswellia that helps, omega-3 fatty acids that help. There's also I can't think of it. It's made from chicken cartilage.
Anti-nature type 2 collagen.
Yeah. Though there's evidence for that. So there's better things out there to spend your money on.
Yeah, definitely. And I think we're still riding the wave of the glucosamine wave of like 20, 30 years ago of it's a cure for arthritis. And this teaches us to keep on our toes, though, doesn't it? Because 20 years ago, people really thought this was the be-all and end-all. And unfortunately, as more studies come out, it's like, sorry, guys.
Yeah.
This is what I want to know. I'm interested to see if we're from another mother. I want to know what you do. Do you do pain relief trials?
Only if I see something on exam. Otherwise, I'm going to insist on things like let's take an X-ray of that dog's legs or whatever.
Yeah, I think it's very difficult. I saw a lady in the park once, and this was many years ago, and her dog was on a long line. It had a muzzle on, and she was at her wit's end, and she was just having a tough time. And I saw the dog running, and it had its hackles up for no reason, but not all the way. It was just over the lumbar spine. And I said to her, I think I'd go and get an examination just in case that's something there. And she came back. I saw her in the park a few months later. She went, thanks. Thank you. I can't believe it. He's now on an analgesic protocol, and I feel like I'm actually getting somewhere. So yes,
Yeah.
veterinary intervention, pain trials over here, they're not contentious. It's just there is no clinical literature to support how to do one. That's all.
Right. Right.
And final one, because I know you've got to get back to work. Noise fear, is it likely to increase with increased pain? I don't think it's linear, as far as I know.
Right. I would agree. Who knows? But there's always that potential.
Yeah, definitely. Thank you so much. Like, seriously, I've just had such a pleasant 55 minutes. I think anybody that's been listening has got awesome amounts out of this. Please say thank you. Please interact. Give back by saying thank you, Dr. Petty, for your time. I enjoy speaking to people like you because I just feel like I could sit with a cup of tea and a scone and we could just put worlds to rights. So thank you so much for giving us your time. Please, Cam followers, remember Big Barker. If you're looking to invest, I have one. I sleep on it when I'm watching TV. It's fantastic. And please do not forget the Big Walk. It's seriously, it's beginning to cost an absolute sweet fortune to run this platform. So your support, it's just £10. £10 for a month worth of information. Nothing. Please sign up. We really, really would like to see you. Thank you so much for tonight. And Cam followers, we will see you next week.
Thanks for having me.